Good morning. I'm here with the Minister for Health and Ageing and with the Minister for Regional Australia. We are expecting some divisions, so if the division bells go, we will of course go and attend to that in the House of Representatives. We're here today to announce the opening of the next round of the Health and Hospitals Fund. It's a round dedicated to regional Australia. It's a round valued at $475 million. It's a round that regional Australia will be able to participate in. Applications will be judged and the applications close in October and the decisions will then flow through into the budget next year. This is part of our continuing investment in regional health, and we're making that investment because we know that health circumstances in regional Australia are very different from metropolitan Australia. To give you just one example, life expectancy in regional Australia is 1 to 2 years lower, and for remote areas it is up to 7 years lower compared with major cities. We have continuously invested from the Health and Hospitals Fund, a fund totalling $1.8 billion. In making these allocations to regional Australia, we have been guided by their differential health needs. And of course, we've received strong advocacy from Labor members who represent regional electorates, as well as from Mr Windsor and Mr Oakeshott. I'll turn now to the Minister for Health, who will be able to outline some of the projects that have benefited in earlier rounds.
Thank you very much, Prime Minister. People will recall that $3.2 billion was originally allocated to this fund from a range of different projects. They are all starting to come to fruition across the country. For example, I visited the Nepean Hospital, where the new intensive care unit has opened and is starting to provide services to the community. Of course, following those initial allocations, where over 30% were already dedicated to regional Australia, our government announced the dedicated funding that the Prime Minister mentioned for $1.8 billion worth of investments in regional health services. That has been allocated, as you would have seen in the previous budget. Already a number of the smaller projects, like the Inglewood Medical Centre in Queensland, is up and running, has already attracted a second doctor to a small community and has established links with allied health professionals. You go from those quite small projects to much larger scale projects, like the $44 million project at the University of Tasmania, their Menzies research facility hosting 300 staff and research students. And of course, you can look across the country and see that plans, construction and services are being provided as a result of this dedicated focus that we have on health and hospital infrastructure across the country, with a very heavy emphasis on the shortcomings that have been in the past in regional areas, and our recognition that they needed to be turbocharged, if you like, to make sure that regional Australians can get the health services that they need. We had a lot of applicants last time round. We had many successful applicants, but many others who were disappointed that they were not chosen. They will be able to reapply. Many of them will have reconsidered their projects, seen whether they can have other partners. Simon may want to comment, have been working with universities and local councils and others to make sure that the projects are the best projects for local communities. Our independent board will again assess each of those projects and give advice to the government which ones are appropriate to be considered for funding, and those announcements would be made in the budget context next year. So I know there's an enormous amount of interest in regional Australia for this next $475 million, and we're looking forward to high quality applications which the board can consider and then the government will consider in the budget process. Thank you.
Thank you. This is another important commitment by us to supporting regional Australia. The health dimension is one aspect, obviously the education round as well as the Regional Development Australia funds. I think the interesting thing that we're starting to see now happen is that because there are opportunities on a number of fronts for regions to identify their needs and prioritise their needs, we're getting a lot of effective dot joining. The Launceston Hospital is a great case in point. I was down there recently, and what they've been able to do because of access to the national broadband network is to provide from the Launceston base a hubbing arrangement to 8 remote locations around the northern part of Tasmania. This enables diagnosis to be done without people having to travel into Launceston for the initial check, and obviously, depending on what the diagnosis establishes, then booking in a time for them to come. We're also seeing great opportunities emerge in the regions where teaching hospitals and nursing facilities are also being combined with the health service delivery mechanisms. So this is an exciting time for regional Australia. This is an important new investment, another $475 million going in. When you think of it together with the $500 million in terms of the Education Infrastructure Fund and the opportunities that present themselves from the National Broadband Network and the connectivity that links those 3 important areas, no wonder regional Australia is embracing this, not just enthusiastically, but in a creative way. And that's what we're challenging them to do, and they are rising to the challenge.
Thank you.